What causes false positive results in newborn CF screening? Imagine a baby's first health check revealing a possible sign of cystic fibrosis when, in fact, everything is normal. That's what a false positive in newborn screening means. It can be confusing and stressful for families, so understanding what causes these results is important. The first factor involves the screening process itself. Newborn cystic fibrosis screening usually starts with measuring a chemical called immunoreactive trypsinogen, or IRT, which is released by the pancreas. In babies with cystic fibrosis, IRT levels tend to be higher. But elevated IRT can also happen in babies born prematurely, those who had a stressful delivery, or if the baby is ill. These situations can cause the test to suggest CF when it's not actually present. Next, if the IRT level is high, genetic testing is done to look for common cystic fibrosis gene mutations. However, these tests often focus on the most common mutations, not all possible ones. Sometimes, only one mutation is found, which indicates the baby is a carrier of the gene, not that they have cystic fibrosis. Carriers do not have the disease but will test positive on genetic screening, leading to a false positive result. Another reason for false positives is the limitations of the genetic panels used. Since they don't detect every mutation, some infants may have mutations that aren't included in the test. This can lead to ambiguous results, where further testing like the sweat chloride test is needed to clarify the diagnosis. Biological and technical factors also play a role. Variations in how samples are collected, processed, or analyzed can cause inaccuracies. For example, if the blood sample is taken too early or too late, or if there are issues with laboratory procedures, the results might be misleading. Additionally, temporary increases in IRT caused by illnesses or stress can mimic signs of cystic fibrosis, even if the baby doesn't have the disease. Certain medical conditions can also influence the screening results. For instance, babies with meconium ileus, an intestinal blockage often associated with cystic fibrosis, may have elevated IRT levels. Other pancreatic or liver issues can similarly cause false positives. It's important to remember that a positive newborn screening is just the first step. Confirmatory tests, especially the sweat chloride test, are essential to accurately diagnose cystic fibrosis. The sweat test measures the salt concentration in sweat, which is typically high in babies with cystic fibrosis. Most infants with a positive initial screen do not actually have the disease but need this follow-up to avoid misdiagnosis and unnecessary worry. In summary, false positive results mainly happen because of elevated IRT levels from non-cystic fibrosis causes, detection of carrier status, limitations in genetic testing panels, and biological or technical factors. Proper follow-up testing and careful clinical evaluation are key to making an accurate diagnosis. Always consult healthcare professionals for personalized advice and further assessment.